support featuring CJ Davis and some of his team from Burrell Behavioral Health, and we're really excited to get started on this today. Recently, through some of our business outreach, we were asking our employers, what do you need most? What can we do to help support you? And one of the biggest topics, actually from one of our essential businesses, they said, we understand that people are very anxious about this, but specifically, they were producing labels that go on hand sanitizer and different things like that needed to stay in the market. And she said, I need tips on how to get my people back to work and to help reassure them that this is going to be okay. And I said, well, I know a guy for that. And so we reached out to CJ and his team and are really excited to get started. But before we do, I would love to kind of give you a little background on our speaker so that you understand who we have here on our expert panel. So CJ Davis is the president and CEO of Burrell Behavioral Health, with more than 25 years of experience in the mental health industry, as both an executive and a clinical psychologist. Dr. Davis has attained his Bachelor of Science in Psychology, a Master of Science in Clinical Counseling and Psychology, and a doctorate in psychology. He has managed and practiced in nearly every level of behavioral health care, including community treatment settings, residential treatment, primary care behavioral health, inpatient hospital services, and criminal justice. Dr. Davis previously held executive leadership positions in Missouri, Pennsylvania, and Indiana, focusing on improving accessibility to care at each stop in his career. After being hired as president and CEO of Burrell Behavioral Health in 2017, CJ has remained committed to accessibility, mission expansion, and promoting community conversations related to behavioral health issues. He was named one of Springfield Business Journal's Men of the Year for 2019, and by Biz 417, one of the 10 for the next 10, and also the magazine's Biz 100 for 2019. And I had the pleasure of getting to know CJ first when we were on the 10 for 10 crew, and man, listening and reading through that bio, I thought, I am in the wrong group. Somehow I have landed in the wrong place. But without further ado, CJ, we'll turn it over to you and just kind of hear what you have to say about how we can talk to our employees about anxiety in the midst of COVID-19.
Great. Well, it's a pleasure to join you. Can you hear me, first of all, just to do a mic check? Okay, perfect. Yeah, it's a pleasure to join everyone. And these are really interesting times. And I hope that the information that I provide today will provide you information for not only the symptoms that you may encounter within yourself or somebody in your family, but also truly to look through the lens of what an employee may be experiencing. And I think with that, I'm going to run through a bit of a PowerPoint that I'm hoping is helpful. So I've done this presentation before, and it's really important that we talk about sort of the second public health crisis that's happening. It's the mental health crisis that will follow shortly after the COVID-19. And we call that flattening the second curve. And this is really significant because there is a growing number of individuals that have currently are experiencing new mental health symptoms. Think about it for yourself, taking a bit of an inventory here. How many times in the last 4 weeks have you felt anxious? Have you felt nervous? Have you experienced your mind racing, where you started to think about the worst, or you felt isolated and down? And I think there are many of us that are truly in that boat right now. And imagine what it's like then to juggle and manage performance at a place of employment. So I'm going to go to the next slide here. We know right now that this is really amazing data that a couple weeks ago, 35% of us indicated that our mental health symptoms have worsened over the past week. Now, you may think that seems to be a bright line, but it's actually up from about 22%, which we saw in February. And frankly, that's normally what we see. Usually about 2 or 3 out of every 10 individuals experience concerns about their mental health. And this number continues really to grow. That is now elevated to 55%. 55% of Americans right now have a concern about the mental health, their own mental health, or the mental health of a loved one. Now, let's put that just in perspective. 1 out of every 2 of us. And I think that number is going to continue to grow. One of the things that you hear all the time is that social distance, social distance, social distance. Now, we really try to promote that and make sure everybody understands when you hear social distancing, that does not mean social isolation. And of course, that also dramatically applies to the workforce, which we're going to talk about in a bit. But what we try to say rather than social distancing is that we want to have physical distancing while experiencing emotional connection. We know that isolation is a very important thing that we manage and that we monitor closely in people. And so what we're finding is that through social distancing is that we're having a lot of individuals in our society that are feeling extremely isolated. And so why is that isolation so concerning? Well, what we're going to end up finding is that isolation is going to load on a whole host of other mental health concerns. We know that isolation impacts hopelessness. We know that isolation impacts helplessness. And those feelings often lead to increased instances of depressed mood. And in fact, they also load on suicidal ideations. So imagine that person that has an interpersonal loss. They're at home working remotely, as an example. They're feeling hopeless because they don't know when the end is in sight. And they're feeling helpless that they can't do anything. And all of those things then drive us in this state of loneliness. Now, you may have followed some of the information that's been pushed out here nationally over the last few weeks, but we are a world that lives in loneliness. And in fact, loneliness rates in the United States have grown almost 200% over time. And again, when you look at those things, those factors, those are the kind of factors that generally lead to someone experiencing suicidal ideations and the thought of taking their life. So isolation is very concerning to us. So as an employer, you have to figure out ways to combat most of the workforce feeling isolated right now. So let's just give you a quick state of the state and put it in perspective. We know that suicide's been climbing for years, and we know that millions of Americans have been depressed. The worst thing about it is that of those 17.3, and it's probably more like 20 million Americans have experiencing some sort of mental health condition, including depression. We know that about 80% of those people don't seek care. So think about the current situation. We have workers that are working remotely. They're feeling isolated. They're feeling hopeless and helpless. They're starting to feel depressed and highly anxious. And now all of a sudden, they're not seeking care. So this whole thing around isolation, although it's great for us to combat the COVID-19 in terms of the pandemic, it's not great for our mental health. And we're going to talk a little bit about that in a second. So how are people coping? Well, we've seen since February an increase in online therapy of 65%. We've seen that app-based treatment has increased its users by about 50% over the past month. There are a couple of those programs out there. For example, My Strength. It's basically a web-based video instruction, educational materials on mental health and how to manage your mental health. And there's another app out there called 7 Cups of Tea, and 7 Cups is a support group that anybody can log on and chat with people who are supportive. We also know that insurance carriers are beginning to waive copays during COVID, and that there's been a lot of privacy restrictions that have been lifted as a result of the COVID. And now we're able to do some service by email, by text, and by telephone. So the whole landscape of services provided in the behavioral health industry have dramatically changed since COVID. And the reason that it's dramatically changed is that, we have to now look at models to assist people from the comfort of their own home. So there's really 4 groups, and you can think about where you fit in, and you can think about where your employees fit in. And what I can tell you is all of us fit into one of these 4 groups. The first group is A-COVID, and you're probably wondering, what does A-COVID mean? That's the anxiety of COVID. Those are the individuals that experience anxiety as a result of the COVID crisis. And it's just sort of a generalized worry. And I'm going to go over those symptoms a little bit later so you can identify some of those. But that's the bucket that most of us fit into. And within that bucket, there's often a lot of catastrophic thinking. There's a lot of what if scenarios that we play out in our world. And so that's the anxiety of COVID bucket. The second bucket of individuals are those individuals that have pre-existing pre-existing mental health conditions and also are experiencing anxiety with COVID. So in other words, somebody who is depressed and now forced to isolate and forced to lose some contact with the world may experience some increased depressive symptoms. Or somebody who is anxious may find that they refuse to leave their home. They refuse to go to the grocery store. They refuse to talk to people. And so individuals with a pre-existing mental health condition with COVID, we are seeing an increase of those individuals and their symptoms becoming worse. Then we have quarantined individuals. You're either quarantined because you came in contact with somebody and now you're living in isolation for 14 days, or you have been diagnosed with COVID and you have to live in quarantine. And we know those individuals have very unique set of symptoms, which I'll talk about in a second. And then the fourth bucket is the frontline workers, those individuals that are truly on the front lines working with all of the individuals that are either symptomatic of COVID or test positive with COVID. So I mentioned the next public health crisis, and this is sort of what it looks like. You can see that the COVID-19 curve that we've all known to love and to watch very carefully is the COVID with protective measures. We know that we want to flatten that curve. And we want to flatten that curve for a couple of different reasons. We want to flatten that curve to make sure that we decrease the number of positive cases, but we also want to flatten that curve to make sure that the healthcare system can provide adequate care and does not go above and beyond capacity. Well, we know that mental health services have been like this over time. So it's interesting that we talk about not exhausting our healthcare system, but the number of mental health concerns right now in our world pre-COVID is there's an existing mental health crisis. Now on top of that, what you're experiencing is a second wave. And that is the second major curve that we're trying to flatten. And so you would say, okay, we're going to really have that much of an increase in mental health concerns in our community. And the answer to that, frankly, is yes. Now, embedded in that curve also is the fact that we are going to experience and witness increased addiction. We have already seen that alcohol sales have started to rise, and that people often use substances as a way to deal with feelings of loneliness and isolation. We also know that there's increased domestic violence occurring in our homes right now, as well as something that's extremely concerning that we don't think about too often is that the number of child abuse and neglect hotline calls is only 40% of what it normally is right now. And so we're having some interesting things happening within the family dynamic that is leading to a spike on top of all the people that just experience some anxiety of COVID. And what the protective measures are really for us is to make sure that employers, where they're doing our part to create a culture that pulls people in and gives them support. And then the other two things really is to make sure that people engage in care. So if you experience a symptom or you know a loved one experiencing a symptom, that we engage them in care. But then those folks that are part of that pre-existing mental health group, that those individuals remain in care. So we have to get way out in front of this to make sure that one public health crisis doesn't lead to another public health crisis. Now, the worst thing about this from a mental health point of view is you may ask, how long will this go on? And if we look at the data with other disease outbreaks, other pandemics from a psychological aftermath perspective, the literature clearly states that we have about 1 to 3 years of individuals probably experiencing similar symptoms to post-traumatic stress disorder, especially those frontline workers. But it's going to take a while for our world to get back into emotionally connecting with each other. And so the symptoms that you're experiencing now, we anticipate that some of those symptoms will be with us 1 to 3 years. If you look at some of the SARS data, which was another pandemic, and you look at towns or cities like Toronto, they found that their citizens were experiencing significant trauma 1 to 3 years post-outbreak, which means we found a lot of people that had anxiety related to COVID, and that anxiety actually led to clinical anxiety, or those folks that had depressed mood as a result of living in isolation. Some of those cases moved into actual clinical depression. And so we are getting ready to embark upon a journey that's going to be for the next few years, something that's going to be pretty significant for our employers around mental health. So how do we flatten that curve? And I'm going to talk about employers in a second, but the very first thing is we have to check in on each other. That's really important. And we have to make sure that it's more than just an update. It's more than a walking by somebody in the hallway and say, how was your weekend? How are you doing? When we exchange pleasantries, we really have to check in with people. And I'm going to give you some strategies as an employer on how to do that. We have to make sure that we encourage our friends, employees, and colleagues and family members to all engage in care. That's extremely important. Our services right now have been increased. And part of that reason is that we're able to offer telephonic services. So literally, if somebody's at home, they're experiencing symptoms, or they're experiencing some performance issues related to their work, or they're feeling disconnected and start to elicit some depressive symptoms, or starting to use some substances or misuse substances, you can literally call a place like Burrell and have a telephone service and have ongoing telephone services throughout the COVID crisis. So engaging in care has never been easier before. And if you think about it, the one sort of myth about, and sometimes it's true, is that the reason that people don't access mental health services are really two reasons. One, they're fearful that they will be judged. And then the second thing is they have come to learn that it often takes a long time to get into services. Fortunately, during the COVID crisis, we've never had an easier time for people to engage in care. Access is extremely easy. It's literally a matter of picking up your phone. You also have the ability now to talk to somebody on the phone. Now, I think that behavioral health services is more of a relational-based service, and it doesn't always mean that you have to be face-to-face. I think face-to-face is important, but telephonic services can be very critical for somebody experiencing some symptoms related to COVID anxiety. And then, of course, those individuals that already have an existing mental health condition, we want them to remain in care because we don't want their symptoms to become worse over time. So this is a key slide for employers. What can you do? I think probably first and foremost, it really provides all employers an opportunity to form and solidify and truly identify what your culture is, especially when it comes to mental health related issues. I can tell you right now, there are 3 out of every 10 of your employees experience a mental health condition. And the truth of it is, it's probably more like 5 out of every 10 employees experiencing some sort of mental health condition or symptom that's impacting their performance at work. And so this really gives you an opportunity to reach out and connect with your workforce in ways in which you may have never done before. In fact, Mark Cuban, owner of the Dallas Mavericks, was talking about this was his big opportunity to reshape the culture. So we recommend that you connect regularly. And for example, most employees right now are working remotely. And so when we talk about connect regularly, what does that actually mean? Well, when you connect regularly, you can establish some pretty easy protocols when you check in with people. When supervisors or leaders call employees at home, we follow the simple 3s. We ask individuals, how are you doing? What challenges have you experienced? And how can I help you? So before anything happens from a business point of view, at Burrell, we've created a check-in protocol. We also want to make sure and encourage everybody that you have EAP services ready. That you know that I've just mentioned that over the next 1 to 3 years, you could have some ups and downs with some of the behaviors of your workforce. And do you have an EAP that's serviceable and ready for your employees? In the event that they need to access behavioral health services, there's a mechanism for them to do so. Here at Burrell, one of the things that we're really proud of is we created what's called a Be Well community. And every single day at noon, from 12:15 to 12:45, we actually have multiple members of our clinical team put together on Facebook a community where our employees can call in. They have music, they have meditation, they have deep breathing, they have check-in. It's sort of an inspirational moment for you to check the temperature of your workforce. And it's been pretty remarkable. Although we have 1,800 employees at Burrell, we've been averaging around 300 people calling into this Be Well community that we've created. And frankly, it's been one of the best culture drivers that we've established, probably that I've been a part of in my entire career. Now, we also offer that very similar Be Well community for community members and stakeholders. So anybody can get on there from 12:45 to 1:15 every single day, and then you can be a part of the Be Well community. And what that really tries to do is it really tries to establish and promote the interest in what we all have as a basic human need, which is connect with others, to get a break from work, to take your mind off everything that's going on, and to provide some coping mechanisms for people to get through this very tough time. I think the last thing that we would really encourage all employers to do around COVID is to provide them as much information as possible. This is one of those things where you truly, as an employee, you feel as though this is very unpredictable and that you have no control. And even the best communicating environments of an employer can be challenged on how well your workforce feels in terms of how they feel communicated with. We send information almost every single day. We've also held some company-wide conference calls every Friday. And the reason that we do that is simply to make sure that we are controlling the narrative about what we're doing for our workforce and what we're doing to make sure that the clients we serve are safe and how our employees feel safe. It's really become one of those things that employees feel like no matter how great of a job you're doing, they still feel like the company is not taking care of our safety. And so you have to push as much information right now in a highly unpredictable environment as you possibly can. These are some symptoms, and we put these up here, and as a psychologist, when I read these symptoms, I think to myself, yeah, these are symptoms that are just basic 101. But a couple different times when I've provided this presentation, I've had multiple people contact me and basically say, gosh, I've hit every symptom. I didn't realize that was a symptom of adjustment, or I didn't realize that was a symptom of anxiety. So I'm going to run through these because it's worth it for you to take an inventory of yourself, but it's also for you to be aware of some of the things that employees will be feeling. So first of all, any type of anxiety or adjustment related issue, adjustment to some environmental issue, we're going to experience difficulty concentrating. And that's probably going to be the most prominent adjustment related anxiety symptom that we can see. And often what you'll find is that your mind will just slowly wander. And it'll wander all around, and you'll start thinking about all those what if scenarios, and you'll start thinking about catastrophic thoughts, but you'll really have a hard time concentrating on your work. The other thing that we notice is that people experience fatigue, and they experience sleep disturbances, and that can be difficulties falling asleep, and that can be difficulties going back to sleep once you wake up in the middle of the night. Generally, difficulties falling asleep has to do with some sort of mood or depression, and difficulties falling back asleep once you've been up in the middle of the night, that's generally driven by some sort of anxiety. The third symptom that you'll see is a lot of paranoia and fear. And that will be one that will continue, that 1 to 3 years that I was telling about. That'll be those folks that 6 months from now still don't want to come back into work because there's no vaccine and they're still concerned about contracting the virus. Now, that will be, of course, we've heard that there's going to be some sort of vaccine, and so that may not be a year or so from now. But the paranoia and fear, most psychologists believe it's going to lead to increased cases of what's called agoraphobia, which is fear of public places. I think we all have a bit of agoraphobia right now. Think about the last time you went to the grocery store, the last time that you pumped gas. How much hand sanitizer did you use? And what did you think of when you were in the grocery store? So we're all living in this state of paranoia and fear right now. And there will be a portion of your workforce that continues to live in that state of paranoia and fear beyond when we all return back to work. I've mentioned a couple different times the irritability and moodiness. And that's going to look like being quick-tempered. That's going to be a little bit more down than normal. And that maybe from time to time, you'll see somebody go sort of be on highs, and sometimes they'll be on lows. From an employer point of view, all these things are going to lead to both high and low job performance. And it's going to be confusing. What we're really good at of leaders generally is knowing our people. And you can kind of depend on Joe or Jim or Sally to do their sort of steady Eddie job. They're always consistent. They're always there. And now all of a sudden you're going to see them work remotely, or you're going to see their job go really low performance, or you're going to see their job performance go really high. And that will be not necessarily something probably related to their skill set, but that could be related to the fact that, Jim and Joe and Sally fall into one of those 4 buckets of mental health concerns that I mentioned earlier. Of course, we live in sort of what I call a pigpen fog. This is what is sort of all over us, over our heads all the time. And that's the generalized worry and apprehension. Everywhere you go, you sort of think about COVID. You think about bringing COVID home. You think about one of your loved ones getting COVID. Think about what would happen if you had COVID. And so the body can only deal with that for so long. And we are forced to deal with this for a prolonged period of time. One example that I gave, which I think is the best example that I can think of, living in COVID is sort of like if you had a fear of flying and you had to get on an airplane every single day. So think about that for a second. If you really had anxiety of flying and you were forced to get on an airplane every day, that's the best way really to connect with the generalized worry and apprehension that most people are feeling as a result of living in this new environment. And of course, I mentioned it several times, thinking about the worst, or what's called catastrophic thinking, where we catastrophize in our brains and we catastrophize in our minds, and that the worst is going to happen if I go back to work, or my employer never takes care of me, or I am going to get sick, and what if, and what if, and what if. And the what ifs, unfortunately, are truly endless in this particular environment. So the good news, as we all try to flatten the mental health curve, remember it's remain connected, it's remain in care, it's engage in care. And the best thing about it right now for employers is that really care is just a phone call away, and it can happen truly in the comfort of your own home. So we've always had a 24-hour crisis line. If anybody's in a crisis where they feel like they're suicidal, or in some cases homicidal, then they can always call our 24-hour crisis line. But we also now have the ability, as I mentioned before, to provide phone services. And phone services are something that we're finding that the community is responding very well to. In fact, I looked at some data this morning, and 79% of our services, 79%, 8 out of every 10 service that we provided yesterday was based upon either a telehealth platform or a telephonic platform. So it's really important that, if you normally would say to yourself, I've got a loved one or I've got an employee and I think they need something, I really don't want to say anything, now is the time to say something. There's a saying in the mental health world that we all need to engage in what's called QPR. Q, you need to make sure you question people. Question that they're okay. If they say something that's concerning about being down, question what that means. Help yourself understand what that means. The P would be persuade them to get into care. Persuade them to engage in care. And of course, the R would be refer them to care, which once you've talked them into it and say, yeah, you can do phone services at Burrell, once they say, well, yeah, I think that sounds like a good idea to me, then you can actually make a referral for them and give them the phone number. So with that said, I've probably talked too much. I wanted to give high-level information, but I'd be happy to answer any questions that you may have.
Well, CJ, first of all, just let me say that was a phenomenal presentation. And I know that you have given this through a couple different resources in our region, but I learned a lot. And as we work on the long-term recovery strategy for our businesses, we tend to just keep our heads down and look in the weeds, and we're looking for financial things and, what does it take to actually do the job? This is such a big part of that, with workforce being something that challenges all of our employers on a normal basis. These are really great things to be aware of so that you can kind of navigate through that. I had one question just to start. On one of your slides, you referenced an EAP plan. What can you elaborate on that a little bit? What does that stand for? What is that?
Yeah, EAP is an employee assistance program. Most HR teams are aware of what an EAP what they are. Essentially, what it allows generally is that an employer offers some additional mental health services for their employees. It often will involve some sort of telephonic service or limited number of face-to-face services. The number that you'll see as an industry standard will be sometimes somewhere between 3 and 6 sessions. So if I'm an employee and I'm feeling depressed and I go to my human resources department and they say, hey, CJ, utilize the EAP program, our EAP would allow us to have 3 to 6 either face-to-face services and or telephonic services. And for the most part, it's for crises. But if the 3 to 6 services doesn't seem to put your symptoms in a desisting situation or lessening of those symptoms, then that can then move into a situation where you can then utilize your benefits for behavioral health services. So it's an added service for your employees around mental health.
I really appreciate that explanation. And, what we see here in Christian County a lot, we have a large number of very small businesses. About 65% of our employers that are here directly in the county have fewer than 15 employees. And what we see with a lot of those is that, they might not have an actual HR person on staff with them. And they're trying to juggle and keep all of that together. So really do appreciate it. We had a question come in, and Natalie is actually the one that spurred me to reach out to you in the first place. And she asked, you mentioned that some insurers are waiving copays. Do you know if Cox Health plans are waiving copays for televisits with Burrell?
That's a good question. And I don't know the answer to that. I know that some of the federal funding is supposed to be dedicated towards treatment as it pertains to COVID, both on the physical medicine side and on the behavioral health medicine side. What I've heard from some of our folks that are accessing care here is that some of those copays for some have been waived and others haven't. So I think it really depends on the payer. I'm not sure, frankly, about Cox. I can find that out for you and get back to you.
Yeah, if you could, that'd be great. And then we can forward that on. Some questions that were submitted in advance, because again, we're recording this and we're reposting so people can kind of view at their leisure. A lot of, personnel manuals and different things might address time off for sick leave, for actual physical sickness, and they don't often address sick leave for mental health issues. Are you seeing, or do you have suggestions on how employers might help navigate that to be sensitive to their employees and make sure that when we, start to roll back to work, that those things are addressed?
Yeah, so I'm not an HR expert. That's my disclaimer that my attorney told me to tell you. But what I can tell you is, a lot of organizations have created some additional either paid time off or mental health time off as a result of transitioning back. I know I was on a conference call last week that talked about trying to come up with a mental health benefit. I really believe, though, that this is an opportunity, as I mentioned before, if you can really create the culture for people that going back to work is going to be the kind of environment that they need for their own support system, that I think that and do some things creatively for folks returning back to work. I think that's another thing that I haven't really spent much time talking about is this post-COVID world. But, we had a meeting yesterday talking about what are we going to do to welcome back our employees and to make sure that in a world in which we want to retain all of our employees, how do we make sure that they feel like they're coming back to a really supportive atmosphere, and that's going to be a place that they want to be? I think I'd spend some time thinking about that as well.
Thank you. Another question that we had come in says, I am curious if workers who are also caregivers of kids out of school or homebound parents are experiencing increased or different stresses. If so, what can employers do and keep in mind to support those workers?
Yeah, I mean, I think that for those individuals that are caretaking at home full time with their kids and all of a sudden being teachers, parents, employees, and support systems for their family, I think there's really excellent information out there of what to do with kids to make sure that we're also identifying symptoms that kids may be experiencing. For that, those individuals, those symptoms that they're experiencing that I mentioned earlier will be very similar. They're going to have the difficulty concentration, difficulty with worry. They're going to see some difficulties with sleep. They're going to be overwhelmed. The problem with it is that they have no outlets. And so if you're living at home and you're already being fairly isolated, how is it that you can encourage them to reconnect with their support systems during this time? You know, having the ability to get on Zoom meetings with family or house party as an app or whatever that may be, they need to reach out and develop better support systems for themselves during this time.
Thank you. Another question that we had received earlier was specifically in relation to interaction, interpersonal relationships. I was talking to someone the other day and they said, all the kids are out of school, as we just talked about, everyone's getting divorced. It just seems like, the sky is falling. Specifically with those interpersonal relationships, tips to not make rash decisions kind of under this umbrella. And this might not be the best time, to make a big life-changing decision. Can you speak to that a little bit?
Yeah, and it's never a good idea to make a life decision in the moment of a crisis, first and foremost. And we all need to do our part. If you're at home, for example, what we're finding is that a lot of people are spending an inordinate amount of time watching TV, watching social media. And so one of the really important things as a first step is to keep your world very, very structured. Almost write down a schedule for yourself so that you don't have tons of free time for your mind to wander into areas of thinking that are really catastrophic for you. So somebody that sleeps in and then has no schedule, that's a recipe for disaster. You need to keep your same schedule, your same sleep-wake schedule. Go to bed the same time, wake up at the same time, write a schedule for yourself. This will help the parents that are at home with kids as well. Write a schedule for them. Stay away from substances. Make your environment extremely predictable. Try to limit the amount of social media that you watch. Try to limit the amount of TV that you watch. Do some things that are what I call freelancing in your brain. Put puzzles together, do some drawings, listen to music, have some downtime. Those are the sort of basic things that I'm hearing people struggling with the most.
Yeah, it's really been interesting and challenging. I've on different calls we've talked about how any kind of crisis, I think, brings about this desire for connection even more so. And this is so unlike anything that we've seen before. And, of course, you see the things on Facebook that says, I hope things don't go back to normal. Normal wasn't working. And I hope we all take something out of this, and cherishing that interpersonal connection and that time with other individuals is definitely something that I think we can all take away.
Yeah, we have clearly taken a pause. And what this is really encouraging us to do is relationally reconnect. And sometimes when you relationally reconnect after a long period of pause, there is a getting to know each other phase again. I mean, we can think about this, that I spent more time with my wife talking probably over COVID than we normally do. And there's a resetting experience that we all have in our relationships. And sometimes that's going to disrupt the old ways of relating to each other. And it's creating some benefits to marriages and to families that were unexpected as a result of this. Clearly, the amount of time that we have to spend with one another and at home to take advantage of that time is important. And I think in the end, we're going to look back and say, yeah, although there were some pretty significant challenges, there's going to be some pretty significant benefits as well.
Absolutely. And you mentioned a couple earlier. Are there suggestions for apps and, easy to use tools for specific segments of our community, maybe our seniors or those kinds of things that we can share?
Yeah, I think probably the app that I would promote the best or the most would be My Strength. You can get that on Burrell's website, and they also have their own website, and they have an app. And so let's say, for example, you're experiencing symptoms of depression and or anxiety. You can actually go into My Strength and you can look up anxiety, or you can look at trouble sleeping, or you can look at marital issues. You can look at any host of sort of traditional behavioral health concerns, and it'll give you educational information. It'll give you videos. It'll allow you to log your mood, allow you to track it yourself. And that's a really great app. The other one that my wife and I and family, of course, that we have 18-year-old twins. It's old to them, but new to us, is House Party. The ability to have family meetings with people out and about where you can get on your phone, everybody can reconnect. And, we were talking about in our house the other night, we normally wouldn't see our family once a week because they live out of town, but through House Party and social media, we have the ability to connect with them weekly. I think that's important. The last app that I mentioned before was 7 Cups. That's a really interesting app. In fact, the owner of 7 Cups of Tea was a student here in Springfield, and now he's sort of gone viral with his app. And you can get online and you can chat with a listener, and you can talk a little bit about what you're experiencing, what you're feeling, and that listener will be a support system for you. And they also have educational materials for you to access on their website.
Those are amazing resources, and we really appreciate you sharing. Sarah, have we had any questions come through the Facebook stream at all that we need to address?
I've not seen any questions come through, but a few comments, just being grateful for this information and thanking you for your time and being here and sharing these wonderful resources. It's a great bit of information.
Oh, thank you. I'm glad to do it. And again, one thing I want to make sure that everybody knows, if they don't have, if they don't want to go through the web-based applications for education, we are literally a phone call away. Never been easier.
Yeah, no, I so much appreciate that. And I know when we first got to talk, you said, my goal is that, we'll really transform Burrell Behavioral Health into kind of the Mayo Clinic for mental health. And we're so fortunate that we have such an amazing resource right here in our region, as you mentioned. And for those that are with us, we also have great resources through our hyper-local entities. Our chambers are doing things through some counselors that are right here in the county. I think the Nixa Chamber is doing with the counselors through Nixa Public Schools. The Ozark Chamber is working with Dr. Cindy Baker from Touchstone Counseling. So really stay in tune to these resources. We will post this on our website. And if you have additional questions on this topic, please feel free to email us at info@showmeccmo.com, and we'll get that forwarded to CJ and his team or to those other resources we mentioned. We're so grateful that you were here to join with us today, and we'll stay in tune. Really appreciate it.
Thank you. Be well.